Imagine the scene. A bustling emergency room, the air thick with urgency and uncertainty. In the midst of it all, there's Cleveland, an elderly gentleman living with Alzheimer's. A man who, like millions of others with this condition, has lost the ability to communicate effectively. He's alone, scared, surrounded by unfamiliar faces and sterile white walls. Now imagine being Cleveland's caregiver. You know his fears, his preferences, his needs, but you're separated from him by a barrier of regulations and protocols. You're on the other side of the curtain, your heart heavy with worry, your mind racing with unanswered questions. This was the challenge faced by Patricia, a dedicated wife and caregiver who found herself locked out of the communication loop during Cleveland's medical emergencies. She watched helplessly as Cleveland became increasingly distressed, unable to articulate his fears or discomfort. Patricia knew something had to change. She began to seek out solutions, tools that could bridge the communication gap between Cleveland and his healthcare providers. After countless hours of research, she stumbled upon a promising solution. Speaking with hospital quality care executives explaining the regression this strict security procedure was causing her husband and patient. Communicating to one specific individual has been a game changer in providing a voice for the voiceless by allowing caregivers immediate access to their patients while in ER. Executive Officer Jan Olivas at Mountain View Hospital helped those with communication difficulties express their needs, wants, and feelings through their caregivers. She understood the importance of the caregiver's presence, emphasizing how efficient and effective the caregiver's presence and knowledge escalated care, avoiding misunderstanding and lack of information. She knew that caregivers knew their patients. Patricia introduced the simplicity of the need for the caregiver's presence, to which Cleveland's visits became less of a struggle. As his caregiver, I could easily explain the different needs: thirst, hunger, discomfort. Caregivers are resourceful, they speak Alzheimer's, dementia. Caregivers know their patients. It was a small step, but it had a profound impact. Cleveland was no longer voiceless. He had a way to communicate his needs, to express his fears. He had his trusted caregiver, his earthly protector. He was not alone, no longer afraid. He had a familiar voice, oftentimes a recognizable face. But Patricia didn't stop there. She advocated for Cleveland's rights, ensuring that the medical staff were trained in caring for patients with brain disorders. She made sure that Cleveland's voice, however symbolically represented, was heard through her. And that made all the difference. Cleveland's medical visits became less stressful. His care became more personalized, more human. Patricia's dedication and advocacy had given Cleveland a voice, a means to communicate that transformed his healthcare experience. This is the power of giving a voice to the voiceless, of seeing beyond the limitations, beyond the disease, and recognizing the human being within. Yet too many individuals, just like Cleveland, remain voiceless. They are lost in a world that doesn't understand their language, their needs, their fears. So let's draw inspiration from Patricia and Cleveland's story. It's a story that reminds us of the importance of communication, of empathy, of advocacy. Let's remember that everyone has a voice, even if we can't hear it. Let's take action to ensure that these voices are heard. Let's use the tools at our disposal, be it assistive technology, patience, or empathy, to bridge the communication gap. Because everyone deserves to be heard, everyone deserves to have a voice. And it's on us to make that happen. So let's start today. Let's give a voice to the voiceless.